right now I'm in a realm that I guess you might say was a woman's world for so long. Not true now, and we're going to go to the source right now and tell some of you guys out there how you might speak to Dr. Bharat Shah. Dr. Shah, thank you for having us in here. Now we're talking about the world of plastic surgery. All right, so often, I think it's most men's opinions, oh, that's not for me, guys don't do that. That's really not true anymore, is it?
No, things are really changing a lot. Mm-hmm. Men are more interested in plastic surgery or even non-surgical ways to look better.
All right, I want to talk to you about that a little bit, because I think if I were going in, I don't want everybody to know that you've been cutting on me or anything like that. I think guys tend to play it a little closer to the vest, wouldn't you say?
That's the big difference between men and women. Men want it to be a secret. Mm-hmm. And so in plastic surgery, we've come up with kind of the stealth operations and ways to get things done without their friends knowing.
Well, tell me the difference, because you said surgical, non-surgical. Mm-hmm. Give me the difference there.
Sure. So traditional surgery we still do for men. We do facelifts, brow lifts, tummy tucks on some men, liposuction, breast reduction, hair transplant. Those are surgical procedures.
All right.
We do a lot of non-surgical procedures: Botox, Dysport, wrinkle treatments, fillers, peels, Ultherapy, which is an ultrasonic facial tightening. All those kind of things can be done in the medical spa without any downtime.
I was going to ask, is this something that someone could do on a lunch hour, so to speak?
A lot of these non-surgical procedures are literally a 1 hour or 30-minute visit, and so they can go back to work the same day, and that's very attractive
and very important too. Yeah, the stealth idea that appeals to me. I assume it's going to appeal to a lot of guys, because you don't want everybody going, "Oh, what did you have done?" Exactly. You want to sneak it in.
And then there are the guys that love bragging about it, because they figured it out, and they want to make sure they tell their friends that they figured it out.
Is that what? Are you seeing that is what's happening? More guys are talking to more guys, and this aspect of your field is growing now?
It is, and it's becoming a lot more common for men to be comfortable with talking about it. Mm-hmm. And again, they kind of brag about how they figured out the way to look better. It may be as simple as laser liposuction. Mm-hmm. They find something they want to fix, and men are fixers. They see what they want to fix, they want to know how to do it, and we get it done.
And on both sides of the equation, we're talking about, you and I were talking a little bit earlier about, I can go on YouTube and I can see how these procedures are done. Not necessarily so. You shouldn't necessarily believe what you see there.
Sometimes you can get too much information, and you can get scared by all those videos you see. So the best thing is come and see your doctor and find out what we offer or what your plastic surgeon offers, so that they can tell you really the real deal.
All right. If I were to come into your office and say, Dr. Shah, I just want to look better, what kind of things do you recommend? Because when you're saying this stealth, it's saying, I'm not doing a whole big makeover here.
Right. And a lot of guys, as they get a little bit older, they can come in and say specifically, I want to make my eyelids look less puffy, or I've got these wrinkles here, or I've got this neck problem. So most people come in knowing what they want.
Right.
And I can guide them that way. However, if they're not quite sure, I just kind of look at ways to tune things up. We don't want a complete overhaul. Right? You still want to look like yourself, just better.
And that's also something that we were talking about a little bit earlier. You still want to look yourself. You don't want to come out looking like a whole different person. That's not what you recommend.
No, you really want to look natural, and you want to look appropriate for your age, and you want to make sure that you just look refreshed. That's really the goal. It's not making people look necessarily younger, but just better for their age.
Walk me through the steps. If I were to make an appointment with you, and it's like, Doc, I want to look a little younger, a little healthier, whatever you want to call it, what are the steps you would take me through?
So I usually do kind of a top to bottom analysis. So I might look at a man, I'll look at their hairline, look at their brows, their eyelids, the shape of their nose, their jawline and features, see how good the neck is, if they need any work on their neck. So we just kind of talk about those things, and sometimes we keep going. They may want to look at their abdomen or their chest or other things that they want to refine, and so I let the patient really guide me. But I look at, when I meet somebody, what do I see first? I see their eyes, I see their smile.
Right.
You kind of, guys look at each other's hairlines when they meet each other.
Yeah.
So
it's an alpha thing.
It's an important thing, and so when you walk in the room, that's part of the way your face is shaped. And so I analyze that and go over each step with the patient to figure out, what do they see, and how do they want to be presented when they come into a room?
And, truth of this is, for instance, myself, I had LASIK surgery. You notice I'm wearing glasses again. This is not an eternal fix-all. You still age, do you not, even after this type of either surgical or non-surgical procedure?
You're exactly right. The clock keeps ticking, right? And we keep aging. But what we try to do is keep up with it. It may mean a little maintenance, collagen stimulation treatment, wrinkle treatment, really good sun protection, because the sun is what's aging us, and then controlling other things, diet, stress, other things like that that help promote wrinkles. We want to really go against that and get people to age more gracefully.
So you think men are becoming more accepting of this now?
They really are, and there more and more are coming in. I think when they come in for something very simple like a Botox treatment, and they learn about what is there, because they're not out reading about this stuff necessarily. Once they get in, they see a little bit, then they get an education and they can decide what's right for them.
All right. So, whether overt or covert, you might consider plastic surgery as a gift to yourself.
Ozarks Live. Now, earlier we heard from Dr. Shaw that there are plenty of stealthy ways for guys to have some work done. So I decided to find out some options available for me. Take a look.
So one of the simple things that guys come in for is wrinkle treatments. As we age, sun damage, been at the lake for many years, it starts to take its toll.
You're looking at me like I have wrinkles.
Well, I can find a couple.
You can find a couple.
And some of them are from a lot of smiling also. So what we can do is treat those without knocking them out. So you still have your expression, but it softens the wrinkles and slows down the wrinkling process.
That's one thing that you hear people so often worried about. It's all of a sudden it's going to be this rick that's just pulled so tight your personality's gone.
Exactly. And especially think about what you do for a living. Your expressions are so important. So my job is to be able to make those wrinkles softer. They may not go away completely, but be softer without altering your ability to have expression.
All right.
And I think that's the most important thing that people don't realize, is that with the proper dosing and tailoring, customizing to each patient, you can achieve that. Okay?
Show me what
So I'll show you the type of areas that I would usually do. Make a big smile. And okay, now relax. And what we look at is what everybody calls the crow's feet. So, and you've seen us on your show treat with Botox, right? And that's a very typical area that we would treat.
Okay.
So I'm going to turn your head a little bit, so when you make a big smile, those wrinkles really stand out, and then you relax. And so we would literally be treating in each one of those areas tiny injections, okay? And within a week, they soften, okay?
So this isn't instant, it's
Correct.
a gradual. That's part of the stealth.
Yep, it's a gradual onset over a week.
All right.
Literally takes 5 minutes to do the injections. It's very simple.
Okay.
And the other area, I'm going to reach across here.
Sure.
The other area would be to treat these wrinkles that we have here. And we look at them as how many lines are there. So if you have one line, it's a 1.
Yeah.
If you have 2, it's an 11. And you have a 111. So you have 3 lines.
I have 3 lines, yes.
So by just putting a little Botox or Dysport in these muscles that cause the frowning, it relaxes it and helps to smooth it.
Okay.
Very simple.
That is very
So
simple.
I get a lot of guys that come in and say, everybody says I look mean all the time. They can't help it.
Yeah.
Those muscles are overreacting or hyperreactive. Just by softening them a little bit, that kind of crease, looks like Mr. T.
Right.
Kind of fades a little bit, and they just look brighter, more well-rested, and less mean.
So this is just kind of giving you a roadmap, telling you which roads to follow.
Exactly.
All right.
Exactly. The other thing we'll sometimes do is filler. Okay.
All right.
Now you wear a mustache, but as this comes down a little lower, there's a crease that forms right here.
Oh yeah.
Right. It's right next to what's going to someday become a jowl right here. Right. So we actually add a little bit of volume in here to bring it out, so you get a smoother cheek. Right. And many times we'll even treat in between here in this little triangle here.
Right.
To soften that trough, so that it is a little smoother. We're not going to smooth it out completely, because that wouldn't look natural.
No.
But just to soften it so it doesn't, the overhead lighting casts a shadow, makes it very obvious, very simple. And these things would take 5 to 10 minutes in the office.
This is kind of a lunchtime procedure, what you're
guys
talking about.
love it.
Now what about if I say, yeah, but I want to get rid of this kind of thing? Now where do you start looking?
Sure. So I'm going to draw here. So if you put your chin down just a little bit, I'll look at the region of the neck where there's some fullness there, okay? And that would be treated with either liposuction or the ultrasound therapy, right, depending on whether we're in the operating room or not, okay, and someday a neck lift, okay. So a neck lift is a little more advanced. It's a procedure, right, surgical procedure, and that's done with incisions which are hidden around the ears. So if you think about it, we have skin here.
Yeah.
Well, we're going to work it up back this way to get it nice and tight, and then you'll see I can grab some stuff here.
Yeah.
That skin is worked around the ears and a little incision around the ears and allow that to trim the excess skin, bring everything up nice and tight, and it lasts 10 to 15 years. So, you really get a long-term result from a neck lift.
Yes, yes. And again, when you're talking about stitching behind and around the ear, that's kind of another little bit of stealth procedure, I would imagine.
Right. Once it's healed, great.
Yeah.
But remember, we got to go through the healing process for a couple of
course.
weeks. And with women, it's very easy because they usually have long enough hair to cover that little incision, and you don't even see it. Guys, where their hair is short, it's a little more of a challenge, but I've done it on guys who have their heads shaved slick bald.
Right.
And they do great. So it's just a matter of preparing the patient for the amount of change they want and what it takes to get there.
Tell me about realism, as expectation.
Sure. So every consultation, that's really what we're going through is what can I do for them and what can't I do, right? So we want to make sure I can show them a little simulation in the office by examining and lifting the tissue and showing them. And if they like that, they'll really like what we can do in surgery.
Great thing about Dr. Shah, he is so easy to talk to, and he makes it so understandable for you.
Yeah.
He's not throwing out jargon. He'll explain, he'll say it's a this, what that means is, and he's a nice guy and incredibly professional. You feel like you're in good hands.
Yep. I just wish he wouldn't have used permanent marker on there. When we come back.